All right, now let's return to the increasingly politicized election debate over mandatory vaccinations. The Prime Minister saying today that any federal public servants who refuse to be vaccinated will face undefined consequences. We saw today at another campaign stop in Aurora, Ontario, the Prime Minister being confronted by anti-vaccination protesters there, some pushing and shoving taking place. What effect could the highly charged political debate on vaccination have on efforts to protect Canadians and curb the fourth wave of COVID-19? Raywat Deonandan is an epidemiologist at the University of Ottawa, has joined us regularly over the course of the pandemic. He's with us again. Mr. Deonandan, thanks for joining me again today. What do you think of the way the debate over vaccines is unfolding in the election campaign, the kinds of confrontations we're now starting to see at some campaign stops?
Well, the pandemic has a way of exacerbating existing divides in society. These divides are socioeconomic, they're racial, they're age-based, and they're ideological. So it's not surprising that even something as you would think innocuous as vaccination seems to fall along ideological lines. And it's being situated as a values issue, which to my mind is unfortunate. Right? So it's being situated as something to do with the individual autonomy of our bodies to not be forced to accept an external thing like a vaccine. What I'd prefer is that if we talked about the larger public good that's also at risk here. So we have a precedent in society of not allowing or of allowing the state to interfere in my bodily integrity. For example, the state tells me I can't inject heroin into my veins, right, and I can't sell my organs. So this is just an extension of the extent to which government can dictate what I do with my body if it's in the public good. Now, it's odd that we're not having this larger discussion about the values at play here. Are the values here about individual autonomy? Or are they about the public good? So to the extent that that exists, that's happening, it's understandable that it's being forced into the election milieu as an ideological divide.
Right. So, I mean, how do you get around that? I mean, if it's being talked about as a values, not a public health issue. I mean, what's a way to approach this where you think there can be an informed civil discussion around vaccination without seeing the kinds of images we're seeing on a campaign trail?
Well, what's missing is the larger goal here. I think we all agree that we want to get through the pandemic. So what are the truths on the ground? The truths on the ground are we have this hypertransmissible Delta variant. We have insufficient vaccine uptake. We have mitigation strategies like mask wearing and distancing that have been largely effective but insufficient to stop the pandemic locally. That leaves the greatest tool available to us, which is vaccination. So it hasn't been couched in those discussion terms yet, is what do we all have in common here? What we all have in common is a desire to get out of this mess. And to that extent, vaccinations are our best tool. So what remains is the extent to which we want to deploy vaccination and at what scale. And I don't think the citizenry has understood it in those terms yet. This is our best way out.
Right. So what they are hearing in a campaign is, the Prime Minister making it clear today that if his party's reelected, any public servants who refuse to get vaccinated will face consequences, although he didn't specify exactly what the consequences might be. Is that an effective approach?
Well, not really. Here's why. It's unclear what those consequences are, as you point out. The consequences probably are you got to take a few extra tests, which doesn't strike me as being distinct from the other side's policies, which are kind of like the same. Not going to force vaccination on you. If you don't want it, take a few tests every week. We can't sustain that way of living. The testing milieu is not an effective strategy for a large number of people to get through this anytime soon. So I think the party that gets through this victoriously is the one that shows true leadership in saying the higher good is public health. And public health gets us through this mess faster. The majority is behind that messaging. The majority wants vaccination.
Yeah, the Prime Minister seemed to be suggesting today that that idea, was of more rapid testing for public servants who refuse vaccines. Says that was a mistake being floated by public servants. That's not going to be the case. There will be real consequences, he's saying, without identifying that. And I wonder if that kind of approach, has an effect entrenching people who see it as an attack on their basic rights.
I think it's unavoidable. That's going to be the case. But that number of people is going to be small and probably weren't supporters of the Prime Minister's platform to begin with. So I think you have to cater here to the majority of voters. And the majority of voters want to get through this pandemic faster, and they are accepting of vaccine science.
What questions do you think should be asked as this debate goes on? I mean, we're seeing it, as we've talked about, being politicized in the campaign, but what's missing from the conversation? You've touched on where it needs to go, but how do you get at that?
What's missing is, in absence of vaccination, what are people willing to do for the common good? How much are we willing to sacrifice individually? And really, this ultimately is a discussion of Canadian values. We haven't had this examination in some time. It may open up a door to other kinds of discussions like, is it okay now to sell blood? Is it okay now to put a price on human tissue? To what extent is bodily integrity now part of the value system of Canadians? I don't know. But it's an exciting time in a strange way. So to answer your question directly, what is missing from this conversation? The limits of public tolerance and how much are we willing to sacrifice to get through this faster? No one's asked that question directly yet.
What do you see, given a lot of the evidence, the predominant evidence about the effectiveness of vaccinations, and we're seeing that in case counts in hospitals. You're seeing the new cases tend to be largely people who have been unvaccinated or maybe who had one vaccine. There's still people who have been vaccinated getting COVID as well, but their outcomes typically, are better. What's at the heart of the opposition to vaccination that we're seeing in some cases demonstrated so fiercely here?
Well, the vaccine resistant are a diverse crowd. I think it's a mistake to paint them with one color. They're the hardcore anti-vaxxers for whom this is a kind of religion. They're the vaccine hesitant who just need a little more care and education because they need to be handheld through this minefield of misinformation. They're the apathetic for whom vaccination is not a bad thing. It's just not a great incentive yet for them to take that step. Then there are those who want to get vaccinated, but they had the policy options aren't there yet. For example, they need time off work, they need childcare, etc. That last group, the policy options are low-hanging fruit. Bring the vaccines to their door, offer them childcare, give them paid time off. For the apathetic, the vaccine passports are an incentive. And for the vaccine hesitant, we need to talk them through with education and handholding. For the hardcore anti-vaxxers, it's a little harder. Right? So it's unclear exactly what's driving them, except for a deeply seated ideological belief in anti-science.
How useful is it, since we're in the midst of an election campaign, how useful do you think it is to have politicians leading the conversation over what's right, especially, as I say, in an election campaign?
I think it's problematic because once a given person speaks a certain position, their ideological stripes taint the conversation. If the Prime Minister says something, then his detractors will see it as the opposite as being true. If Mr. O'Toole says something, his detractors will see the opposite as being true. I don't know any way around this. I kind of wish it was not a politicized topic. I wish this was strictly a public health topic that did not have the scent of ideology attached to it. But those days are past. It's been that way since the American federal election, frankly, and there's no way out of it.
Let's finish on this. How damaging do you think this kind of a debate taking place in a political campaign, how damaging could it be to efforts to curb the fourth wave and I suppose any successive waves of COVID?
You know, I'm a stupid optimist. I think we may end up with some advantages here because both sides, or more than two sides, but two sides in general, are discussing vaccination and both are inching towards more vaccination. Both are on side with encouraging uptake. The distinction is how best to encourage uptake. So no one is saying less vaccination. Right. Everyone's saying more vaccination. It's just how this is done. So I like to think it's a good sign.
All right. Raywat Deonandan, always great to get your perspective. Thanks again for it this evening.
Thank you.